it's important. Be respectful of these patients' their privacy and their modesty. I was working with a gentleman once in a hospital, and as I got him up, I tried to put a second hospital gown around him as a robe, and he kind of good-naturedly said that wasn't necessary because he had bared it all to so many people in the hospital it didn't matter anymore. He was laughing about it, but unfortunately the reason he felt that way is probably because too many people did not respect his privacy and did not keep him covered. So even if you have people who tell you not to worry about it, please cover them anyway, because even if, you know, Mr. Jones doesn't care if he's not covered, Mrs. Smith out in the hall when he gets out there may not be too thrilled to see, you know, his back end as he walks by. So keep that in mind for everybody's modesty and comfort. Get the assistance that you need before you transfer a patient. If it's an assistive 2 transfer, please get somebody to come in and help you prior to setting that patient up for a transfer. You don't want to get them halfway up for a transfer and then find out that nobody's available to help you for another 5 minutes. And by the time they're in there, the patient is tired and needs to lay back down. So get assistance and plan ahead. Be aware of any personal equipment that that patient may have. If they've got oxygen tubing, IVs, catheters, you need to make sure that you know that tubing's there so you're not pulling it out during a transfer or getting it stuck on some of the equipment. Also, braces are important, and you may not know right away that they've got a brace, so you really need to be aware when you walk in a patient's room. Look around, observe. Sometimes a brace will be laying on a bedside table. Sometimes it will be down by their shoes. And braces are important. They may need a knee brace to stabilize their knee during a transfer, and if you don't put that on, you may find yourself in an unsafe situation in the middle of that transfer. Safety and body mechanics is important. Body mechanics, by that I just mean the way that you're positioning and using your body to perform some movement or activity. And we will go through this again in another tape, and I'm sure you will be reminded of this often, which is good. You want to get that ingrained in you because body mechanics and safety for your back is very important. So just make sure that when you're moving patients, you're always working with your knees bent, using your legs to help do the movement and not your back, and that you're aligning yourself properly and giving yourself the space that you need to perform the transfer. Also, as far as safety, make sure that the height of your bed is appropriate. Make sure that your surfaces are as level as they can be to make the transfer easier. Make sure that you always have the wheelchair locked. Just a couple of things I'd like to show you with the wheelchair that can make the transfer easier for some people is to remove the armrest of the wheelchair if it's in the way. That can be done by simply pushing on the little lock button and pulling up on the arm of the chair to remove it. And then the patient can sometimes more easily slide across or be helped by being pivoted or moved across to the other surface. Make sure that when you put the arm of the chair back in, that you are replacing it until you know that the safety button has popped through the hole, and then check it to make sure that it's locked in place. Leg rests are very important to move out of the way. When you have leg rests sticking out like this, you can trip over those, your patient can trip over those, they can hit their legs on them and injure themselves. It's best to just get them completely out of the way. Leg rests remove in various ways. None of them are very complicated. You'll either have a little pin that you pull up to swing the leg rest away. This one happens to have a little metal bar that you just push, and it helps to swing the leg rest out of the way. When the leg rest is swung away, that's when you can lift it up off the pins and remove it. Make sure that you don't put it down where you're going to be transferring. Get it completely out of the way so it's not interfering. After the patient is back in the chair, make sure that you replace the leg rest. These need to go over the pins while it's in a swung away position, or else they just won't fit over the pins properly. So while it's swung away, replace it over the pins and then push it back and make sure that it's securely locked in place. Just another note is the safety belt, and I know we've talked about that before. But always use a safety belt in transferring a patient. Explain to them why you're putting it on, but use that for their safety as well as yours. And very importantly, take your time. We all know that we're busy while we're working, but a couple extra minutes to make sure that you do the transfer correctly and properly, and that the patient feels comfortable with that transfer is well worth that extra time that it takes. So slow down, care for your patient in a relaxed and casual way so that they don't feel anxious and nervous about what you're doing with them. The final point in considerations is very important. I can't stress this enough. This is to involve the client. When you are working with a client or a patient, when you are transferring them, you need to always explain what you're doing. And don't think that because you explained it yesterday, you don't need to today. Many of these patients are confused, they're forgetful. They may not even remember who you are when you walk in the room. So introduce yourself each time. Tell them who you are, what you're planning on doing with them. Tell them, Mrs. Jones, I'm here to help you get up for breakfast, and I'd like to help you sit up on the edge of your bed, and I'll help you to get into your chair. And as you're doing the movements, explain to her how you're going to be helping her and what she can do to help as well. Reassure her so that she's not anxious or uptight about these things. And also ask for your patients to help you as much as is appropriate, as much as they're able to do. There's so many times that these patients just have things done for them continually. They just start to believe that they are unable. They believe that they can't do it, that they are worthless, they don't have any use. And that's really a terrible position for a patient to start to, a terrible way for them to consider themselves. So, very, very importantly, ask them to help you. For one reason, kind of the use it or lose it idea. If they're not using their muscles and using these, doing these activities, they're going to lose their ability to do this. When we're working with a patient in physical therapy, we really appreciate the follow-through. If I'm in working with a patient and I'm trying to work with her on coming to a stand from a wheelchair more independently, and I'm there 2 or 3 times a week, and you're there daily and helping her get up, 3, 4, 5 times a day, if you are just pulling her up to a stand, then my work is really not going to pay off. So it's really helpful if you can have the patients help with as much as they can just from a rehab standpoint. And like I said, most importantly, psychologically, that patient needs to feel worthwhile and needs to feel like they can do some things. And I really think that you'll develop a better rapport with your patients, and they will feel more cooperative about doing things with you if you enlist their help and ask for their help. What I'd like to do, there's a few devices that you may see commonly used in different facilities that can help you with moving or transferring patients. And I would like to demonstrate a couple of these for you and at least show them to you so that you're aware of what they look like. If you see these in a facility, you'll know what it is and generally how it's used. There are some devices that you will find when you're working in facilities that are commonly used to help assist you in transferring patients from one surface to another. I'd like to just show you some of these devices so that you're aware that they exist and what they look like. This is what we call a transfer disc or a pivot disc. May not be used frequently, but in case you see it, you won't wonder what this thing is sitting in the patient's room. This is something that is used on patients who are not able to do a pivot transfer very well, or that they need a lot of assistance with a pivot. They can't move their legs to get from the bed to the chair. They may be stumbling over their feet, and it just is safer for them to actually have their feet on a disc that will just pivot as you transfer them. This disc is just placed under the patient's feet before you bring them to a stand. You make sure that it's securely under their feet, and as you use the safety belt and bring them to a partial stand, you're just pivoting them, and the disc will slide with you. It's not difficult to use, but I would suggest that you practice using it before you ever use it on a patient. This is called a slide board. Some people call it a